Now we are going to have a look into services via telepharmacy. But first, we need to know what is telepharmacy. Telepharmacy is defined as the provision of pharmaceutical care by registered pharmacies and pharmacies through the use of telecommunications and information technologies to patients that are not in the same area. The most typical feature of telepharmacy service is that the pharmacist is not being physically presented at the point of pharmacy operations or patient care. Telepharmacy is first created when the telephone was first installed in the pharmacy during the 19th century. In Malaysia, telepharmacy is a relatively recent advancement in healthcare services. Its adoption and utilization in our country are due to the COVID-19 pandemic. Telepharmacy services have gained more and more attention in order to allow remote pharmaceutical care services during the COVID-19 pandemic, in which several movement restrictions are being implemented globally. Hospital Sungai Buloh is one of the health institutions that had adopted telepharmacy services for patients during the pandemic era, in which they implemented the remote communication via phone or video call in order to obtain the patient's medication history and also to provide medication counseling. The most interesting thing is that pharmacists also take an initiative to send instructional videos for medical device counseling, for example, on the ways to use insulin pen and also inhalers. These videos are sent to the patient's smartphones for the purpose of self-viewing, and once they have reviewed the video, pharmacists would proceed to identify on patient's clarification and understanding through video call. This would ensure that patients fully understand the right techniques and can achieve the targeted therapeutic effects. Moving on, here we have some examples of telepharmacy services. There are actually several types of telepharmacy services offered, which include the first one, drug information services. Drug information services provide information and advice related to drugs via telephone to patients, allowing patients to get an up-to-date, accurate, and complete information regarding the medication that they are currently taking. Pharmacists are the ones who provide medication advice to drug information line, and there are few medication-related questions often asked, which are: what are the common side effects of medications? What should we do if we miss a dose? And how soon will the medication work? The next point is minor ailment services. Minor ailment does not require medical doctor services, any laboratory testing, or blood testing. It can be inspected by oneself. However, the patient requires monitoring and professional advice from pharmacists to manage it. These inspections and advices are given by pharmacists via telephone. And the next one is chronic disease management. Basically, patients are given information on the management of their chronic disease without the need to have a face-to-face meeting with the healthcare professionals. Diabetes mellitus is an example of chronic disease that have benefit from telepharmacy. Patients will receive appropriate treatment counseling and also therapy from clinical pharmacists via phone call or video call, and they can be referred to diabetes educators when needed. The next one is remote dispensing. In this video, we will be focusing on remote dispensing. Remote dispensing is defined as a licensed brick and mortar pharmacy staffed by a certified pharmacy technician. A pharmacist will supervise the technician and review prescriptions, in which these duties are being performed from a remote location via technology. Remote dispensing location is a place where drugs are being dispensed by retail to the public under the supervision of a registered pharmacist who is not physically presented at the premise. It is often being employed in retail community pharmacy and outpatient or discharge pharmacy settings. Spain is one of the countries that have implemented remote dispensing telepharmacy in order to deal with the spread of COVID-19. Medication dispensing protocols were immediately established in order to deliver drugs to patients who could not come in person to the hospital pharmacy department. These measures has benefited patients who could not come due to mobility problems, who suffer from acute illness or complex chronic disease, and also those who are confined to home quarantine due to coronavirus. With this intervention, it allows the hospital pharmacies to perform a clinical therapeutic assessment that is remote. This will contribute to the fundamental objective of pharmaceutic follow-up, namely guaranteeing the achievement of the pharmacotherapeutic objectives established for each type of patient.
Next, we will explain the benefits and limitations of remote dispensing. First is convenient access to a pharmacist and prescription medication despite its geographic location. Rural areas lack of pharmacies and certain medication. When a pharmacist is not available nearby, timely access to a pharmaceutical services can be compromised due to many reasons as shown in my right side. Hence, by setting up a remote dispensing, pharmacists can provide high-level pharmaceutical care services in rural environments that have lost or are losing access to healthcare services, which indirectly will also boost the market growth in the rural areas. Improved access to medication, especially in rural areas, has led to another advantage, which is enhanced patient satisfaction. An assessment of one telepharmacy program in the USA, as shown here, revealed that more than 75% of the patients were satisfied with the telepharmacy since they do not have to travel too far as well as queue for too long to get the medication, which led to a major reduction in waiting time. Since machines are loaded in advance, patients and care provider won't have to worry about getting an order in time. Patients are also financially benefited from telepharmacy. Study on my right side by the Clifton et al. In Washington has shown that more than 60% of people responded that they would have a difficulty affording their medication if their telepharmacy program didn't exist. Another study which was conducted in Arkansas shows that telepharmacy counseling via compressed video was more effective than using a package insert instruction to explain medications or medical devices. Next is saving money. One report by Powell and Leeson in 2016 shows that the cost of equipment at a pharmacist technician is much cheaper compared with opening a new stores and staffing a pharmacist. Plus, telepharmacy uses the skills of one pharmacy for multiple sites without the additional expenses of hiring a pharmacy for a rural site. Also, telepharmacy can eliminate an underused inventory in a rural setting. In addition, since the automatic dispensing machine could dispense only the most used medications and could enhance inventory control and record keeping. Hence, this will also reduce medication waste. Next, we will move on to the limitations of remote dispensing. Having remote dispensing will eliminate the need of pharmacies and instead use an automated medication dispenser. Automation exists to substitute work undertaken by humans with work done by machines, with the aim of increasing the quality and quantity of output at a reduced cost. However, this will also bring disadvantage as many pharmacies are at risk losing their job. Since part of pharmacist's job is dispensing, will be augmented by automation. Other than that, it also removes the in-person interaction between the patient and the pharmacist. This removes the non-verbal cue that could help a pharmacist to decide if the patient is intoxicated or if there are any other wrong condition with the patient. Besides, pharmacist-patient relationship may also be affected since miscommunication may occur.
We are all well aware that telepharmacy remote dispensing is created to make everyone's life easier. This is because this service offers pharmaceutical advices anytime and anywhere. However, there are several challenges that we need to overcome in order to implement this service. And the first challenge would be high cost. Although telepharmacy remote dispensing can bring a huge reduction in the labor cost, however, the startup of telepharmacy itself will require high costs that includes the installation of hardware, software, connectivity, and also operational costs. And this will be a financial burden for small rural healthcare centers as they might not afford to cover all these installation costs. And the second challenge would be the legal implication. Telepharmacy remote dispensing diffusion is hampered by the regulatory differences between countries. For example, only Singapore and Indonesia have guidelines on electronic prescription for remote dispensing, which can only performed by licensed healthcare medical practitioners and must not include narcotics and also psychotropic drugs. Meanwhile, guidelines for Vietnam permits a spectrum of telemedicine services, from diagnosing to prescribing appropriate treatment, while in Malaysia, it only permits online prescriptions other than narcotics and also psychotropic drugs. The third challenge would be the increase in the risk for security and integrity for patient data. The successfulness of telepharmacy services also depends to a greater extent on the level of technological infrastructures that support the security and also integrity of patient data. In any technology that deals with handling of health data, the protection and also encryption of this information are very important. This is important to avoid any data leaking, which otherwise may cause trust issue among the patients. The next challenge would be resistance and also adaptability of both health providers and patients. The resistance and adaptability of both health providers and also patients toward the telepharmacy services can also be an issue. For example, a study in Canada reported a conflict that happens between telepharmacy adoption and hospital staff, where the medical staff preferred to have the pharmacist on site, as they claimed that the service via telepharmacy would lead to the increase in delayed treatment compared with the conventional standard services. Patients also tend to resist remote dispensing due to trust issue. Next challenge would be digital literacy among both patients and also providers. Digital literacy among both patients and providers also must be taken into account. Digital literacy is attitude, skills, or the ability towards information technologies. A study found that older age were associated with fewer telemedicine visits that might be due to lower digital health literacy. Those in older age groups with less frequent use of technology in general, impaired eyesight and diminished hearing and motor skills make telemedicine a challenge. And additionally, families with lower household income or those who live in rural area had a lower utilization rate of telemedicine use. These findings may attribute to the availability of the internet access or devices. Low digital literacy among health providers will require a tough training and education in order to obtain the effectiveness of telepharmacy services.
Next is innovation of remote dispensing service. Innovation of remote dispensing service can be done by upgrading its disadvantages that are stated previously. As we know, to develop and maintain this service, it takes a lot of costs, which includes the hardware, software, buying costs, operational costs, maintenance costs, and etc. Therefore, the Malaysian government should subsidize the price of the automated remote dispensing machine, which can later aid the public hospitals obtain this machine, and in the long run, our healthcare providers can implement this service on a larger scale. Another obstacle is that it consumes a lot of time, money, and effort to start up a new thing. Plus, this service is quite new in Malaysia. Thus, we can search for investors or collaborate with agencies that are interested in remote dispensing service. Examples of telehealth agencies in Malaysia are Dr. On Call, Remedy, Dr. To Us, and etc. By doing this, we can make this service available in Malaysia. Lastly, we can upgrade the system to increase its security and integrity in order to protect patients' data. This can be done by providing access to our patients' data to only certain people. By doing this, we are able to quickly detect the system breach or foreign access towards our data. Another way is by regularly updating the programs, as it is often proven the best way to tighten the system security and also to ensure the data is well protected. This will make the security system only as good as their most recent update and make it harder for the hackers to exploit weaknesses and breach the system.
Next, we will dive into the impact of telepharmacy on the patient care. The impact of remote dispensing on patient care include improving the patient access to the pharmaceutical care. This will allow for more efficient delivery of care and reducing medication errors. Plus, the 2020 Malaysia findings revealed that telepharmacy could improve medication access for patients in rural areas. Thus, this will reduce the financial burden and improve the population health in the country.
Additionally, medication access and information in rural areas via telepharmacy will help eliminate prominent barriers such as travel time and expenses. And this subsequently will improve patient trust and satisfaction with telepharmacy service. On top of that, besides telepharmacy helps in decreasing medication error rates, it also improves the quality of private counseling and provides new channels for education programs. Similarly, a 2012 United States study has shown that adverse patient outcomes, including prolonged hospitalization and potential death, may have been prevented using telepharmacy services as a potential alternative to around-the-clock on-site pharmacist medication review for rural hospitals. In addition, the impact of telepharmacy services has shown that the involvement of pharmacists in the remote review of medication orders resulted in a decreased number of adverse drug events reported. As we all know, adverse drug events and other medication errors may contribute to several thousand of deaths each year. Hence, with the help of telepharmacy, patients' quality of life could be improved.